All right, so today we're going to dig into something pretty interesting. This whole idea of people taking their health into their own hands more and more these days.
Yeah,
Ordering their own tests, using wearables, all that stuff to really get a grip on what's going on with their bodies.
definitely a trend.
It's all about being proactive, right? Like trying to live longer, healthier lives.
Yeah.
And kind of wanting that information like right now.
Yeah, absolutely.
If you're anything like me, you probably like to get to the point quickly.
Yeah.
So that's what we're going to do today.
Sounds good.
There's this whole buzz around health information being accessible, and even more so about being able to get the tests you want when you want them.
Definitely.
So to help us understand this whole thing a little better, we've got some cool insights from Medical Space and the Surrey Cardiovascular Clinic, SCVC.
Okay.
And these guys are like really at the forefront of offering these at-home testing options.
Interesting.
So what we're going to try to do today is really break down why this shift is happening, what kind of tests you can actually do from home, which is pretty wild when you think about it. Yeah, for sure. And like super important, how to get a real medical report, so you can understand those results.
Right, because numbers without context.
Exactly.
Aren't they useful?
And ultimately, like, what does this all mean for, how we manage our own health journeys?
Yeah, that's the key question.
So let's jump right in. What are some of the big reasons why people are so into this home blood testing thing?
Well, I think a big part of it is just that people are more aware now of how important it is to catch things early. Prevention is key.
Yeah.
The internet has totally changed the game when it comes to medical information.
Yeah.
And you see so many more campaigns now about things like high cholesterol and blood sugar and all that.
It's true. You can't escape it.
And people are just more tuned into the risks and they want to be proactive about it.
Right. It's like that whole thing about an ounce of prevention is worth a pound of cure or whatever.
Yeah, exactly.
And it seems like it's finally sinking in that, taking those early steps can actually make a real difference later on. Plus, let's be real. Sometimes it's a pain to actually get in to see your doctor quickly.
Oh, yeah. Tell me about it.
Especially within the NHS, it can be a real struggle.
Absolutely. Healthcare systems are often stretched pretty thin.
Right.
And getting a GP appointment for just a routine checkup can take forever.
Ugh, it's so frustrating.
So it's totally understandable that people are looking for other options that are faster and easier.
Makes sense.
Yeah.
So convenience is a huge factor.
Definitely.
I mean, think about it, being able to just do a test at home whenever you want.
On your own time.
Yeah, that's got to be super appealing to a lot of people.
It is. And the technology has come a long way, too.
It really has.
Like those TP devices, they make it so much simpler than the old finger prick method.
Oh my gosh. Yes, so much better.
It's not this scary clinical thing anymore. It's just something you could easily fit into your day.
So we're basically seeing this move towards consumer-driven healthcare.
You got it.
People are taking charge and being way more proactive about their health.
It's empowering.
It really is. It's like we're saying, hey, I want information and I want it now.
Exactly. It's a shift from just reacting when you're already feeling sick.
Right. It's about understanding and managing those potential risks before they become problems.
And potentially avoiding them altogether.
Yeah, exactly. And this is where that flipped approach comes in, right?
That's right.
Where someone might actually order a test just because they're curious or a little concerned about something, and then they go to their doctor to talk about the results.
Exactly. It's a complete reversal of how things used to be.
It is, and it shows how much more engaged people are becoming.
Yeah, they want to be informed. They want to have some data to bring to their doctor.
That makes the conversation way more productive.
Exactly. You're both on the same page and working together towards a common goal.
Okay, so we have these national screening programs, which are obviously super important.
Of course.
But it seems like private companies have a really key role to play here, too.
Absolutely.
In terms of meeting that demand for more immediate and accessible testing.
Right, because government programs are amazing, but they can be a bit slow to adapt sometimes.
Yeah, they have to jump through a lot of hoops.
Exactly. They have a lot of regulations and procedures to follow.
Right, whereas private companies can be a lot more nimble.
Exactly. They can innovate and respond to what people want much faster.
And that's where SCVC and Medical Space come in.
Yeah, they're great examples of this.
They're really stepping up to give people that control over their health information.
Yeah, so tell me more about what SCVC is doing specifically.
So they've teamed up with Medical Space and Randox Health.
Okay.
And they've put together this whole range of home testing services.
I like it.
It's pretty amazing. They're basically bringing all these diagnostic tools right to your doorstep.
Wow. So what kind of tests are we talking about here?
It's not just the basic stuff like cholesterol checks.
No. I imagine there's got to be more than that.
Oh, yeah. They've got those basic screening panels for sure.
Okay.
You know, cholesterol, HbA1c for blood sugar, thyroid function, all that.
Right. The standard stuff.
But then they also have these more advanced biomarker tests.
Oh, interesting. Like what?
Like they offer testing for LPA, which is this thing that's becoming recognized as a really big risk factor for heart disease.
I haven't heard of that one.
Yeah, it's pretty new. And then there's the carbohydrate resilience test, or
Carbry.
Yeah, it's all about how your body handles carbs. And get this, they can even analyze the data from your continuous glucose monitor if you're already using one.
Oh, wow. So they're really covering a lot of ground.
They are. They have tests for hormone imbalances, nutritional deficiencies even.
Wow. So if you're curious about, like, any aspect of your health, they probably have a test for it.
Pretty much. And the best part is that every single test comes with a medical report from actual doctors at SCVC.
Oh, that's so important.
It is. You're not just getting a bunch of numbers you don't understand.
Right. You need that context.
Exactly. You get expert interpretation and guidance based on your specific situation.
So you know what those numbers actually mean for you.
Exactly. Now, you mentioned the Carbry test earlier, and that one sounds especially interesting.
Yeah, especially with all this focus on being proactive and living longer, healthier lives.
Right. So what exactly does it tell you?
So the Carbry test is all about helping you understand how your body responds to carbohydrates.
Okay.
It's mainly for adults who aren't diabetic or maybe pre-diabetic.
Got it.
And they're interested in, like, optimizing their metabolism for better long-term health.
So it's for people who are generally feeling okay, but maybe they're a little curious about how their body handles sugar.
Exactly. Maybe they've heard about those blood sugar spikes and how they can be bad for you in the long run.
Right. All that stuff about insulin resistance and all that.
Yeah. And since problems with glucose and weight gain are big risk factors for heart disease, it's smart to understand your body's response to carbs early on.
It's like preventative medicine.
Exactly. And the Carbry test combines a bunch of data to give you a really personalized assessment.
Okay, so what does the test actually involve?
So it's more than just a simple blood test. It involves 14 days of continuous glucose monitoring using a CGM, which tracks your glucose levels all day and night.
So you can see how they change in response to what you eat.
Exactly. You also use an app to log your meals, exercise, sleep, all that.
Makes sense.
So you can see how your lifestyle is affecting your glucose levels.
Yeah.
Then there's an HbA1c blood test, which gives an average of your blood sugar over the past few months.
Okay.
And a lipid panel to check your cholesterol levels.
So it's a pretty thorough picture of what's going on.
It is. It's not just a snapshot. It's like a whole movie of your metabolism.
I like that analogy. Okay, so what's the process like if someone wants to take this test?
So first you fill out an online eligibility form.
Okay.
Which basically makes sure the test is right for you.
Makes sense.
They look at things like your BMI, any medical conditions, medications you're taking.
Right.
And a medical team reviews it.
Okay.
If the test is good for you, they send you a kit.
Directly to your home.
Yep. Super convenient. Or you can schedule an appointment at a testing center if you prefer.
Gotcha.
And if it's not right for you, they give you a full refund and explain why.
That's good to know. So there's that initial medical check to make sure it's all safe and relevant.
Exactly. They take it seriously.
Yeah.
So what's in the home kit?
Okay. So you get the CGM sensor, the TP device for the blood sample.
Okay.
A blood bottle for the lipid panel, a tape measure to record your waist size, and a QR code to download the app.
Wow, that's a lot of stuff.
It is. You also have to fill out a health profile form, so they have all the background info.
Makes sense. So then you use the TAP device to collect your blood sample and send it off.
Right, and you put the CGM sensor on your arm. It's super tiny and discreet.
Cool.
You sync it with the app, and it just starts tracking your glucose automatically.
Easy peasy.
For the next 2 weeks, you just track your food, exercise, and sleep in the app as you go about your life.
Sounds pretty straightforward. So then, after those 2 weeks, what happens to all that data?
So once the 14 days are done and the CGM data is processed, a medical expert looks at everything.
Okay.
Your health questionnaire, your HbA1c result from the lab, all the glucose data from the CGM.
Wow, that's a lot of information.
It is. And then they write up a full medical report just for you.
Cool.
With personalized recommendations for diet, exercise, lifestyle changes, all based on your results.
So it's not just data, it's actionable advice.
Exactly. They also give you all the raw CGM data and the lab test results.
Wow. Okay, so you mentioned a carb light option too. What's the difference?
So the carb relay is for people who've had an HbA1c test in the last 6 months
Okay.
and haven't changed their diet or medication since then.
Makes sense.
So they don't need to do the blood test again. It's
Yeah.
basically a faster and cheaper option if you have recent data.
Gotcha. So what are some of the key things this report tells you about your metabolic health?
So it gives you this thing called a current glucose profile.
Okay.
Which is basically a visual graph of your daily glucose patterns. You can see when and how your blood sugar goes up and down throughout the day.
Oh, wow. That would be cool to see.
It also gives you a glucotype, which is basically a way of classifying how your body handles carbs.
Okay.
And the report gives you personalized lifestyle recommendations based on your glucotype and glucose patterns.
So it's tailored to your specific needs.
Exactly. It covers diet, exercise, other habits that can help you improve your metabolic health.
Cool.
And if needed, it'll also give you medical recommendations.
Okay.
Like if they think you should see a specialist or anything.
Gotcha. So it's not just about telling you what's going on. It's about giving you steps to take.
Exactly. So who would benefit most from taking this carb test?
So the sources mention a few groups.
Okay.
First, people with existing heart conditions.
Right, because managing glucose is important for them.
Exactly. Then people who are pre-diabetic or really health conscious.
Okay.
They want to know their risk factors and how to manage blood sugar spikes.
So they can prevent things from getting worse?
Exactly. Yeah. It's also good for people focused on weight management.
Okay.
Exercise enthusiasts who want to optimize their workouts.
Interesting.
And people who've taken the test before, made changes, and want to see how it's affected them.
Oh, that's smart, like a progress check.
Yeah. And it can also be used for early detection of diabetes.
Wow. So a lot of people could benefit from this.
Definitely. Okay, so you've talked a lot about these tests and how they come with medical oversight and reporting.
Yeah.
Why is that so crucial when people are doing more self-testing?
Well, for a couple of reasons. First, it makes sure the results are interpreted correctly.
Right, because numbers can be misleading.
Exactly. You need that context of your overall health.
Otherwise, you might freak out over nothing or ignore something important.
Exactly. And second, the fact that the carb test, even when you order it yourself,
Yeah.
has medical oversight from the eligibility screening to the interpretation.
That's reassuring.
It adds a lot of legitimacy and safety to the whole process.
So it's not just about getting data. It's about getting reliable information.
Exactly. And those medical reports are written so that anyone can understand them.
That's so important.
They give clear guidance on what you might need to do next.
Whether it's lifestyle changes, more tests, or seeing a doctor.
Right. The goal is to empower you with knowledge so you can make informed decisions about your health.
I like that. So beyond these blood tests, the sources also talk about the future of diagnostics.
Yeah, like wearable devices and AI.
It's pretty wild stuff.
It is. They mention things like continuous blood pressure monitors and AI that can analyze ECG data.
It seems like we're moving towards this much more connected and continuous view of our health.
We are wearable tech and sophisticated AI are just the beginning.
Right. It's going to keep getting more advanced.
Imagine a future where data from your blood tests, your wearables, even medical imaging all comes together
Wow.
to give you this incredibly detailed and real-time understanding of your health.
That would be amazing.
It would allow for super early and personalized interventions.
Yeah, you could catch things before they even become a problem.
Exactly. But with all this data comes the need for health education and literacy.
Absolutely. We
Yeah.
need to be able to understand what it all means.
It's one thing to have access to information, but it's another thing to know what to do with it.
Right. Otherwise, it's just a bunch of numbers.
And SCVC seems to get this. They put a lot of emphasis on patient education in their reports.
That's great.
They want to help you understand your results so you can make informed decisions about your self-care.
So you're not just relying on your doctor to tell you what to do.
Exactly. So to sum it all up, it's clear that we're seeing this huge shift towards people taking control of their own health.
Yeah.
Through home testing and wearable tech.
It's about owning your health journey.
Exactly. And services like SCVC and medical space are making it so much easier and more convenient.
Definitely. They're bringing medical-grade testing and expert interpretation right to your home.
And tools like the carb test are amazing for getting personalized insights into your metabolic health.
So you can make informed choices about your lifestyle and longevity.
But as the sources say, home testing is a great tool, but it should always work alongside professional medical advice.
It's not a replacement for seeing your doctor.
Exactly. So as you're listening to this, think about how you might use these advancements to learn more about your own health.
Yeah, what proactive steps could you take?
It's definitely worth considering for all of us. Thanks for joining us on this deep dive.